Doctors of Reddit. What's a medical practice that you think will be considered messed up 50 years from now? Seconding circumcision. One cool innovation that researchers are working on is activation of your own immune cells to fight infections as opposed to antibiotics which actively work to kill infections. The side effects of antibiotics are often pretty nasty, and you see so many people with antibiotic resistance infections from lengthy or repeated hospital admissions. It'd be super neat if we could give a body instructions on how to effectively kill different infections without having to saturate someone in antibiotics and mess up their natural biomes. Just had an HSG test done for infertility management. They insert a balloon catheter into your uterus and expand it, then flush contrast in it to check the tubes with no pain management. I was looked in the eye and told it would be painful. Women are just forced into dealing with pain on scales men are not even familiar with when it comes to female procedures and tests. Biochemistry student who took some pharmaceutical uni classes here. Just giving all people sleep pills so they aren't annoying. Mostly very asshole nurses who do it, but some still do it. It is already considered mostly disgusting, but not that much has been if the pharmacist of the hospital is very much against it. As a cardiologist, I hope the practice of using radioactive material for stress testing goes away. With advances in ultrasound and MRI, I think nuclear stress testing will fall out of favor within the next 20 years. Also, with GLP-1 medications and drug-coated balloons, heart attacks of the future may be treated without stents. Our end student here hopefully as a whole will move away from doing absolutely every medical procedure or intervention on 95-year-olds whose bodies are so frail and can't take it. Modern medicine does prolong life, but it doesn't really stop and think about the quality of life afterwards, or if something is really necessary. Not drowning patients with fluid when they come in with sepsis and early initiation of vasopressors to restore vascular tone. Sepsis carries a high mortality, because one guy published a stupid paper to sell his device that didn't work. We do stupid things that likely contribute to that mortality. Not a dot, but can there be a slightly less barbaric and disgustingly painful way to do pap smears besides a metal torture clamp spreading you wide open? ESPBC vaginismus and other such conditions aren't exactly rare, not to mention young teens getting that treatment as well. Not a doctor, but we seem to be heading in that direction in regards to how people give birth. Lots more are advocating for themselves and giving birth on all fours, or on their side, since it's not only easier on them, but seems to be easier on the baby too. Just the way women pain is taken overall. Eyed insertions, biopsies, uterus and breast and saline sonograms all done without pain meds or anesthesia. And don't get me started about how a lot of women are treated during childbirth. Appalling. Not a medical doctor, although I'm a PhD doctor. I think doing colonoscopies will be a thing of the past. It's super invasive and there's new pill cameras now that will eventually be more widespread for looking at the colon. Surgery done by humans. I think AI robotics will advance in 50 years to the point that a body scan can be done, and a robot can analyze that image and do the surgery by itself without human intervention. Insurance companies denying care because they don't find it medically necessary. A doctor said I need this life-saving procedure. A gym who got a job off of Indeed says I'll be fine. Child gender transitions. Yes, it does happen. 3,678 7.7 were aged 12 to 18 years. Not a doctor US. How about having insurance companies decide what is covered by insurance? Doctors should be making the decisions, not insurance agents. Not an ND. But in an ideal world, in 50 years chemotherapy would be regarded in the same way we look at the past use of lobotomies for mental illness. As a patient endometrial biopsies with no effing pain meds or anesthesia and doctors telling us it's just a little sting. If men had to endure it, hopefully they'll look back in horror at the idea of waiting rooms. Can you imagine waiting in a room surrounded by other sick people? Barbaric. Not a doctor, I believe advances in diagnostic and surgical technologies will mean that future surgery will be less invasive and less exploratory. Not a doctor. Medically unnecessary male genital mutilation. 8. It should be considered messed up already. But we live in a fucked up timeline. Not having same-day appointments if something's suspicious for cancer or other serious problem found on a screening, not talking about an emergency. Not a doctor. Up from a related field, chemotherapy will probably be seen as barbaric in the future. Same as when we look back at lobotomies now. Nurse here. A lot of obstetrics. So much of it is either not evidence-based or based on really outdated, sketchy evidence. Hopefully chemotherapy in account of there being far less toxic and efficacious treatment for malignancies. Circumcision. It is for many parts of the world already, but it'll catch on in North America primarily soon. Not a doctor, but between greed, private equity buying and closing hospitals, etc. It's all fucked up. Not a doctor, but mental issues and addiction are still being dealt with by punishment and voodoo. Unnecessary cosmetic surgery. It will either be non-existing or 6 years will have it. Hopefully the population sees what a scam chiropractic work is. The field of psychiatry needs a revamping, to say the least. Having to pay for necessary medical treatment like insulin,